Hey guys, so here is my presentation for week 2 on the technological innovation that contributes to the quality improvement and supports achievement in one or more of the triple aims. Creating an infographic is not something that comes easy for me. Very challenging. I had a lot of 10-minute moments, but I did focus on improving the patient care experience, overall improving the health of the population, reducing healthcare costs, also a consideration. So being a pediatric nurse, a lot of things that we do to our patients cause them stress and anxiety and pain. And then they just look at us and they don't like us anymore. It's not very encouraging when a child walks into a room and screams at you just because they're there, because they're scared and they're intimidated. If we think about that in the life of a child who has been diagnosed with type 1 diabetes, it just is increased for them. We know that type 1 diabetes is not caused by eating sugar. It's not caused by anything in their lifestyle. It has no cure and it can't be reversed. It requires insulin infusions or injections daily and sometimes several times daily. It's nonstop physical, psychological, and financial burden for their parents and for the patient. It's life threatening and it's very largely misunderstood. Statistically, we know that 40,000 people are diagnosed each year in the United States with type 1 diabetes. Between 2001 and 2009, there was a 21% increase in prevalence in people under 20. Largely, there's $14 billion associated with healthcare expenditures and lost income. If you think about it, in a child, that lost income is of their parents and their family and their caregivers. If you think about the physical and physiological and psychological burdens, you think about being a parent and watching your child go through something like this. So some of the advances that we're looking at are several actually. There are the insulin pens, so the old style way of having to go through multiple syringes and drop your own insulin. They've now come up with insulin pens, so children as young as 7, 8 are better able to treat themselves once they get a handle on disease. With an insulin pen, there is overall patient satisfaction increase and better adherence to their condition because the pen's right there. They just have to dial in the amount of insulin that they need. It has accuracy in delivering very small doses as opposed to having to draw up and calculate. As we know as nurses, it can be quite challenging. When we're giving insulin to our patients, it's a 2 nurse check. Think about a 9-year-old kid who's away, from his family and needs to give himself his insulin. A, it's very embarrassing, and B, it's quite cumbersome to have to draw up and be accurate. So if you're trying to hide it and you're doing it really fast, there's a lot of risk. So insulin pens do reduce that risk. They also say that patients report less injection pain with an insulin pen. It's kind of a smaller needle, essentially, and it fits the patient. Next, we'll talk about the insulin pump. That is a complex system. There's several steps that patients have to go through in order to qualify for an insulin pump because it is something that is a part of your body, right? You're at risk for infection and other things, but it does eliminate the need for multiple injections throughout the day. It delivers your insulin more accurately. Overall, having an insulin pump can actually improve your A1C, which is a level that they monitor in people with type 1 diabetes. It may result in fewer large swings in blood glucose. So if you think about it, a diabetic getting up at 8 a.m. or getting up at 9 a.m. can actually cause a significant swing in their treatment. If they don't live 24/7 on a very regular schedule, as far as taking their blood sugars and giving their insulin injections, they can risk hypo or hyperglycemia, generally hypoglycemia, big drops, which is a big risk for them. Continuous blood glucose monitor. That is a newer technology. It alerts patients to episodes of hypoglycemia and hyperglycemia regularly, right? It is a part of their body that continually monitors what's going on. These predicted episodes are generally picked up much more regularly by a patient. So if you think about it, having all of these advances, you're reducing the amount of daily injections, you're improving the overall diabetes management of a patient, you're improving patient overall quality of care. So all of these things essentially improve patient care experiences. If you think about a pediatric patient and their progression through the disease of diabetes, you can think about that as they grow, they have ever changing insulin requirements. They have unpredictable food intake and physical activity. Their parents can't be with them 24/7, right? And if they are, then they're actually inhibiting their daily life. So, in order for these patients to have regular, real lives, some of these advances are huge for them as far as the patient care experience and their overall health, right? They're not ignoring it just because they want to be normal. They don't have to ignore it because they now have the technology that enables them to treat without inhibiting their actual environment. So those are my advances for the week. Very relevant, I think, to my profession, and very relevant to the actual overall health of the United States based on those statistics. It will be interesting to see what else happens in the advances of diabetes, especially considering, if 5 million people in the United States are expected to have type 1 diabetes by 2050. And that's 600,000 youth. So hopefully we'll see some more cool things, but that's my presentation for today. Hope you enjoyed it.